January when this is going to kick in. Okay?
I think it should give us a look, see, it had to be something, right? So this is trying to.
So what we should do, I know on the website, maybe we can put it up electronic. I'll talk to whoever handles the website and we can put it up electronic so that you're able to access the information.
The PowerPoint for it, yeah, let's do that.
Okay, yeah, I'll talk to you.
And if you have voice recording, that would be great.
Okay.
Okay. Thank you very
Well,
Dr. Talk?
ma'am,
Dr. Talk?
I know Ms. Griffin wants to wrap it up.
Right, but we're running kind of.
Okay. Okay.
Will the contractor be able to speak? Pardon? Will the other doctor be able to speak?
We can do it real quick.
Oh, you have someone else to speak?
Yes, ma'am. She is a practitioner on wellness. She's a chiropractor. She does preventative care. She also works a lot with the seniors as far as doing healthy things to stay healthy so we don't get into the Medicare situation. Someone grab her.
Oh, okay. All right. So, did the person that offered that, did she say anything? No, you're fine. You're fine. Oh,
All right, can y'all hear me from right here?
Yeah.
I'll hear from right here. All right, so my name is Dr. Annie Poole, and I am a chiropractor and a holistic healthcare practitioner. So I do physical therapy, chiropractic, holistic classes like healthy cooking classes. I started a program at one of the Roundtree residences.
Talk loud, but not too fast.
Okay. All right, so basically what I've done is I work with a lot of seniors because I recognize the needs of the seniors are greater and that it seems to be a neglected community, the seniors and the disabled. So my quest is to really do outreach to the particular community for those who cannot get out, who want someone to come in and actually do care in-house and or cooking classes or things of that nature. So I teach healthy cooking classes, how to eat, how to do diabetes prevention, all these things that Dr. Reed was talking about. So when you talk about preventive health care, for those of you who already have these chronic conditions, my goal and our goal is to help you either maintain or even reverse some of these conditions or even help you live a better quality of life. Because I understand people do have limitations to matter. That's just the reality. So basically, the name of my company is Civic Consulting Services. And I have cards. The name of my company is Civic Consulting.
It's on the
It's on the overhead. And so our goal is to meet your needs. Our goal is to meet your needs to better health. And we want to provide you the best health care in a holistic approach. This is my contact information here, and I have cards for you. And if you want cards, I'll have those for you available to you as well. So the company is one of the premier healthcare consulting firms based in Washington, D.C., and we specialize in 3 core areas of health and wellness. Our company is trifold, and we focus on the whole individual comprised of the mind, the body, and the spirit, hence the term holistic. So I know a lot of you as elderly people in the senior community, a lot of you talked about the situation of isolation. And I understand that depression can sometimes kick in. So how do you combat these particular conditions? We get you engaged. So our classes consist of, we do meditation classes also to help you get in tune and connect with the spirit. So that way you know that you have a support group also that's with you. And it's just a way to reconnect. Again, the 3 core essential areas are healthcare. We do that through providing chiropractic services to achieve optimal spinal health, body balance, and communication within the nervous system. How many of you know that the nervous system controls everything in the body? Right, so that's what we deal with primarily. We also do extremity care, so those of you suffering from rotator cuff problems, from knee problems, from ankle problems, foot problems, arthritis, bursitis, all those kind of conditions, sciatica, brachial neuralgia, we handle all of those conditions. So a lot of times people don't know where to go, and we are that gap that can help treat these kind of conditions without drugs or surgery. Our consulting services comprise of the health risk management sector, which includes, we provide health risk management solutions to individuals, corporate and non-corporate entities. So basically that means when we go to different corporations or different areas and talk about health and wellness, we can tailor our health talks towards whatever you want us to talk about and make it specifically geared to you. that way you understand and are also engaged in the process. The other services we provide are personal training services, and we promote that through health of the mind, through training through thought processes, through visualization, and meditative techniques, and physical training through exercise and nutritional counseling. A lot of us don't know how to eat, so we end up doing the same things over and over again, perpetuating the same things in conditions that are still degenerative. We want to try to reverse those conditions. Does that make sense? So our mission is to provide the highest quality of healthcare and educational programs to our clientele and patients. So that basically means that we want to make sure that you're getting what you need from us. The purpose of us is to introduce and offer our unique services to individuals and organizations or companies, and this is our way of meeting your needs by providing conservative wellness and preventive programming. Are any of you interested in preventive programs? Wellness programs? Nutritional classes? Okay. Especially nutrition? Yeah, it's a huge need. Any of you guys ever meditate? Right. Do any of you guys practice meditation at all? At least 5 minutes a day, sitting down with your thoughts, reconnecting. So there's techniques that you can use, and there's all types of meditative techniques that you can use, and we can explain some of those things to you also. So our goals are to promote awareness. That's through health and prevention and safety in the workplace, the home environment, and or your community. And again, the senior population is a large community. We want to educate our clients and community in becoming aware and interested in health topics that directly impact their health. How many of you here have diabetes? Hypertension? Know someone who had cancer? Had cancer? Had or have, right. Cured. That's all right. That's great. So these are the things that we do. We want to help also decrease the incidence of stress-related. You are blessed. That's awesome that you're healed. So again, we want to decrease the incidence of stress, healthcare disparities, and injuries on and off work, if you're still working or not working, by providing educational and interactive workshops. Now, all my workshops are interactive, so I don't know about you, but I don't like sitting in the audience or see people sitting in the audience and just listening, raising their hands, and not being engaged. Well, I want you engaged in the process, okay? Makes it much more interesting. So again, here's a picture of a chiropractor and some of the things that we do. Again, we look at x-rays, we do physical examinations, we do neurological and orthopedic testing so we can determine what the problem is, and refer you to necessary healthcare professionals as needed. So has anyone ever been to a chiropractor? Do you know what we do?
Yeah.
Okay, what do we do? You do that too? That's right. And some people say it feels like a massage. But what we're actually doing is feeling along your spinal column to see what the nervous system is doing, because what happens is when you have a spasm in your back, what happens is that nerve that's coming out your spine is either overactive. And when it's overactive, your body starts shooting off different energies, so it is not balanced. So our whole goal is to put those joints back in alignment so the body can send out the proper messages to your organs and all your system organs. Okay? So we deal with the relationship between the spinal column and the nervous system, and we remove spinal misalignments, freeing stress placed on the nerves that cause nerve interference, and joint misalignments that alter biomechanical function. A lot of us have hip problems and knee problems. It could be something very simple as something being out of alignment. But sometimes we don't know that. When we don't know those things, the degenerative process kicks in and arthritis speeds up. So a lot of these things can be prevented and or reversed and or just treated in general. Okay? What do we do? By using our hands and other diagnostic instruments, we detect and correct spinal and joint misalignments that interfere with body functions. You know, if a car's out of alignment too long, it wears and tears, the gaskets wear on the whole thing, and everything needs to be replaced. We want to help prevent all that. So that by the same token, we help to restore biomechanics of the spine and the joints, like I said before. Okay? You guys following me? Okay.
Unless you want to do a demonstration on me.
All right, so the populations and communities that we serve from the infant to the elderly to the seniors. So there's no age limit to who we can treat. I've treated babies, people with multiple sclerosis, cerebral palsy, autism. I've treated people that had just from sciatica to all major disc problems in their back, herniated discs. So we treat all kinds of conditions, okay? And we treat all communities. And I'm particularly interested, like I said to you before, the underserved communities. I'm also interested in the uninsured, the underinsured, and for those who don't have access to health care. By the way, I'm also the chairman of the Board of Chiropractic. So what we're trying to do basically is increase access to healthcare through passing certain bills within Washington, D.C. We have 2 on the records now we're trying to pass. So that's what we're doing for community advocacy, for people to have that greater access to healthcare. My licensures and accreditations and certifications, I'm nationally board certified 1 through 4 in physical therapy. I also serve as one of the examiners for the national board, which basically says I go to different states and test students to become doctors. That's what I do to help them become licensed. I'm licensed in Washington, D.C. I have a Kaplan impairment rating certification, so I can rate people for disabilities. I'm the chair of the D.C. Board of Chiropractic, and also the district alternate director for FCLB, which is a regulatory agency within the nation. So I do lots of things when it comes to regulation as well as healthcare. And also advocacy. So you see, I'm pretty well versed in the things I want to accomplish, but not only that, my biggest goal is to make sure that people have access to healthcare, chiropractic in particular. So our program overview is that our goal while conducting workshops is to provide each participant an opportunity to engage in activities that will assist in promoting the development of lasting habits that enhance health and well-being. We know obesity and diabetes, heart disease, and musculoskeletal diseases and other chronic diseases are lifestyle related. How many of you knew that? Lots of diabetes type 2, lifestyle related. What your mama ate is what you ate. And what you eat, your kids eat. So that you perpetuate the same behavior, you get the same diseases. So it's not necessarily genetic, it's bad habits, okay? So our objective is to teach our clients simple and effective ways to make better health choices, and our clients are encouraged to make changes that have a tremendous impact, which begins at home and habits that become generational. So I'm looking at generational changes that we're trying to accomplish, okay? Does that make sense?
Yeah, that
I'm pulled away from some of that. I'm down there about that generation. What mama ate down through the generation.
Absolutely. I mean, it's just like I said. I never grew up eating fried chicken and stuff like that. My mom she didn't cook. And she's from the country, but I'm from New York. But my grandmother, when I came to the country, we had fried chicken, some rice and gravy. I had all that stuff when I came to the country.